don't get me wrong, I think my team is amazing, but I never would have sort of had the the foresight to predict this. Well, I think first of all, it's an acknowledgement of the hard work by the team, and just a bright, committed, mission-driven organization. I'm really proud of that. I think it also is an indication that we're onto something. We are, I think, leading the way in behavioral health care, and so very excited about the mission, the tools and the solutions that we're bringing to make healthcare better in the state of Indiana, make it more affordable, make it accessible, focus on prevention. That's the mission, and every day my team gets up and they live it. So it's very exciting. Yeah, well, so I think that there is we focus a lot on behavioral health, and that's anxiety and depression is something that nearly a quarter of Americans suffer from. So I think leaning into those behavioral health needs, making care more accessible. Rural Indiana, as well as rural America generally, really suffer from a lack of providers, lack of care. There's a lot of stigma around people seeking that care. So I think being able to identify, and help people, acknowledge that they need help, and then get them timely help. I mean, people should not have to wait a month to get in to see a therapist. They should be able to do it in a day, or even less if it's really urgent. So the solutions that we're bringing, one of them that we're working on now, Serenity, it does just that. It helps to, with using AI and voice, vocal biomarkers. It's able to listen to somebody talk and identify whether they have anxiety or depression risk, and then we're able to take that information and prioritize who clinicians should reach out to first. We build a care plan that those clinicians, gives them a little bit of a lead on what some of the needs are and how they can be solved. And we do all this actually to support the patient and physician relationship. It's not like AI is out there replacing clinicians. It's quite the contrary. It's actually there as a tool to empower them and to make that relationship stronger, and to deliver information in a timely manner so that it can be used effectively to drive better outcomes, lower costs, and frankly better provider satisfaction. Well, I mean, it's just an absolute gold mine. I love what one of the gentlemen said today about you don't have to go to the coast to be a leader in innovation. I mean, we've got in industry amazing companies, Lilly, among them certainly. Elanco, the list goes on and on, Cummins. I mean, so you've got industry, you've got, Purdue and IU and other, academic institutions. I mean, so I think it's just a great synergy of all of those things, really bright people. And I think that it sort of feeds on itself, as you innovate and new solutions come to the fore, they get adopted, and then it just drives kind of a even faster, more innovative kind of spirit. Now, love Indiana. I mean, I wasn't born here. I've sort of been a transplant, here to Indiana, but 6 months into being here, my wife said, I love it. We're never moving. So I said, yes, ma'am. And it's been just amazing. And I think that there's so much opportunity. In terms of what's next for Syra, I think that, we have some great innovations going on. There's, the Rural Health Transformation, which is a nationwide initiative being funded by the federal government, is a huge, it's a long kind of overdue need. People have been talking about rural health care and all the, the shortages, the deficiencies, the lack of providers. And so actually having the administration now fund to drive innovation, but also infrastructure that can bring better care to rural America. I mean, that's right in our wheelhouse, and I'm really excited for us to support Indiana and the goals that they've set here. But we're also looking outside to pretty much every state in the nation to see where our solutions fit the needs that are out there, and then we'll be leaning in and seeing if we can help them as well.